Hi, Billy's mum and dad. I'm Michaela. I'm one of the nurses helping to look after Billy today. I've heard that you have a few questions about what's going to happen, so let's have a chat. So, what's croup? Croup is a condition caused by a respiratory virus called human parainfluenza virus. This virus is common and is usually associated with upper and lower respiratory infections like bronchitis, pneumonia, and the common cold. There are 4 strains of the virus, with HBIV1 and 2 commonly connected with croup. Croup itself is not a virus, but rather the body's reaction to a virus. Parainfluenza, although a different virus than the influenza or the flu, has many of the same signs and symptoms: sore throat, cough, fever, shortness of breath, congestion, and wheeze. Croup itself is characterized by the infection and rapid swelling of the trachea, larynx, and bronchioles. When this happens, the body's natural response is to cough in an attempt to push air through the swollen airways. However, as a consequence of this edema in the airways become a little bit fragile and they vibrate, causing the seal-like bar cough that we can see in Billy. These restricted airways are also the cause of stridor, or the noisy breathing we see, as the air is squeezed in and out of the tight larynx and trachea. Croup is considered a children's condition, with children under 6 years old being the primary age group. This is due to the stage of development. Pediatrics are at a higher chance of respiratory distress and rapid deterioration. There are many pathophysiological differences between an adult and a pediatric patient. For example, pediatrics have a narrowed airway and require a higher oxygen demand but have a lower ability for gas exchange. In terms of a respiratory virus, you or I might have a similar infection to Billy, but might only complain of a swollen throat, a slight fever, and a cough, but not really notice a great impact on our ability to breathe due to our larger airway. In fact, an adult airway has an average 15 millimeters circumference, whereas in children like Billy, the airway circumference is only 6 millimeters. Any swelling or an increase in secretion production will cause this circumference to narrow, drastically increasing airway resistance. This resistance will impact Billy's ability to breathe freely and will create that stridor and increased work of breath. Pediatrics also have a higher metabolic rate, meaning that everything is moving faster. For example, their heart rate, metabolism, and usually their energy. In order to keep up with this demand, pediatrics have a higher oxygen requirement and therefore a higher respiratory rate. However, pediatrics also have less alveolar surface area available within the lungs than adults, creating that higher respiratory rate. Alveoli are little pockets within the lungs that allow for gas exchange to occur, meaning that oxygen breathed into the lungs is pushed into the bloodstream and the carbon dioxide is breathed out. We can see that with Billy, he has the higher oxygen requirement, but because of his continually narrowing airway, less oxygen is making its way into the lungs, thus the increased work of breathing, stridor, and the seal-like bark. Airways are first concerned when creating a management plan for Billy. SpO2 monitoring and auscultation is required to identify the severity of Billy's respiratory distress and the potential pharmacological interventions needed. SpO2 monitoring is done by attaching a little light probe onto Billy's finger or toe. It's not painful, but it's important we all do our best to keep it on if Billy tries to take it off. Auscultation of lungs will also be needed, meaning that we'll need to have a listen to Billy's lungs with a stethoscope. A head-to-toe assessment will be performed in order for an accurate diagnosis and highlight of any concerns. All this requires is a quick examination of Billy's body, looking for any rashes, sign of dehydration, urine output, signs of discomfort, and temperature. It's very important that Billy's weight be measured upon admission as well, as with pediatric medication administration, everything is measured in weight. You've probably seen on child's Panadol or Nurofen bottles next to the age bracket is the average weight guide as well. With the medications we're going to give Billy, it's really important that we have the most accurate weight we can, so this will require taking Billy's clothes and nappy off while we weigh him. We may find that all of these quick assessments will probably be a little distressing for Billy, and it's important to know that upsetting Billy will exacerbate his presentation. It's because of this we encourage you to be involved, as you are Billy's safe place. We'll also be utilising some play therapy, one as a way to show Billy what we will be doing and as a form of distraction. Where we can, we generally take a non-touch approach with pediatric patients, meaning that where we can, we minimise the distress of the child and do as much of the assessments as we can at a distance. So you'll probably see us watching into the room or standing at a distance where we can. For Billy, with his current presentation, the 3 most common medications used are oxygen, corticosteroids, and epinephrine. Billy is presenting with moderate croup, so we'll be prescribed dexamethasone 0.15 milligrams per kilogram or prednisolone 1 milligram per kilogram. Both of these drugs are corticosteroids, meaning that they work as anti-inflammatories and work to suppress the inflammation in Billy's airways, thus allowing Billy to breathe easier. This opening of the airway will allow Billy to meet his oxygen demand and will stop that strident or noisy breathing and will help eliminate that seal-like bark. Following these symptoms, you will be discharged. This will be as quick as 30 minutes after medication administration. Now that Billy has been cleared for discharge, there are a few important things to note. Keep your child calm, as breathing is often most difficult when upset. The more a child is distressed, the worse their symptoms can become. You may give Billy paracetamol and ibuprofen if he becomes agitated or has an increased temperature. It is important that if Billy redevelops stridor at rest, meaning that noisy breathing, when he's settled or becomes increasingly distressed, that you seek medical attention. You should call an ambulance immediately if Billy is struggling for breath, becomes drowsy, or his lips turn blue. These are all very severe signs. It is important to know that children with croup can deteriorate quite quickly. As such, it's important that you seek urgent medical attention. So if these things happen, don't drive to us, let the ambulance come to you. Well, that's everything. So if you don't have any questions, you're free to go. If you do have anything you would like to ask later once you get home and you've settled down a bit, feel free to give us a call. All the best. Bye.